I am Dr. Rajat Gupta, board certified plastic surgeon working in Delhi. And what I'll be talking to you today about is a procedure called as Asian blepharoplasty. Now, a lot of patients belonging to Oriental race have a upper eyelid which has no fold, and they would want to have an upper eyelid crease. This procedure of creating an upper eyelid crease and giving them kind of a Caucasian looking eyes is what is called as Asian blepharoplasty. So this procedure is a very personal decision, and if someone wants it, they can get it done. Let me talk to you about how this procedure is done. So, basic aim of this procedure is insertion of levator muscle, small fibers into the skin. If you would see an anatomical image of a person who has an upper eyelid crease vis-a-vis a person who doesn't have an upper eyelid crease, the difference is in the anatomy that a person who has an upper eyelid crease, their levator muscle, the muscle which is supposed to open the eyelid, small fibers of those muscle are inserted into the skin. That's why once they open their eyelid, their skin folds in, the skin goes inside, and that looks like a groove. Vis-a-vis a person who is of Oriental race, their levator muscle is not inserted in the skin. So this tells us that the aim of the procedure is to create a small insertion of levator muscle into the skin. Now, the crease is from the medial to the lateral edge. So the crease has to be made absolutely precise in the shape the person wants, and it has to be a very gentle, smooth curve so that it looks natural. Now, as in any cosmetic surgery, the most important thing in even an Asian blepharoplasty that the result should look natural. No one should notice that the person has had an Asian blepharoplasty done. That's my aim, and that's what most of the patients' aims are. That they get an upper eyelid crease, but it still keeps on looking natural. So for this, what we discuss with patients are what should be the distance of crease from the eyelid edge. This has to be very precise, and we have to mark the crease what the patient wants from medial to lateral. We have to mark whether they want a lateral flaring or not, or an absolute curve. These are small finer details which I always discuss with my patients. Now this surgery is done under local anesthesia, and a person gets it done and go back home the same day. It's like a daycare office procedure. Of course, you will have some swelling and bruising for the first 5 to 7 days, but you can see the crease immediately after the surgery. And as the swelling and bruising settles down, the crease is much more nicer and natural looking, and a patient can appreciate the result. The sutures used in this surgery are very fine on the crease, on the skin edge once we suture, and these sutures are removed after 4 to 5 days. It's a very gratifying procedure, as you can see the result immediately. There is some downtime for 4-5 days because of swelling and bruising, but most of the patients accept that very well. You can be back to the society and doing all your daily activities from next day, and you can resume your social activities after 5 days once the swelling and bruising settle down. The main aim of this procedure is the result is what a patient desires as well as looks natural. Now, I see a lot of patients who have had Asian blepharoplasty surgeries done, and they have a very irregular crease or a very high or a low crease as opposite to what they should have got. So understand that the surgery is very precise because it is on the centerpiece of your face, just on your eyes. Anybody who meets you, they will see your eyelids and eyes first. So any abrasion in that would not look good. As I tail off, you will be seeing some of our results so that you can understand how a natural result should look like. If you, in all of these pictures, if you would see just the after image, you would not tell whether this patient has had a surgery or not, as they look natural. So that is something which we stress a lot on. I've tried to answer some of the questions I'm asked about these procedures. If you have any more questions, please write in to us and we'll be there to help you. Thank you.